Welcome to Complicating the Narrative, a podcast that takes on the challenging questions in public health by embracing complexity rather than avoiding it. I'm your host, Salma Abdallah. Health as a human right. That's a phrase we hear constantly in global health, in conference keynotes, policy documents, and advocacy campaigns. The idea seems straightforward. Everyone, everywhere has a right to health. But what does that mean in practice? And does framing health as a right help us achieve better health outcomes? These are not theoretical questions. We have seen rights-based frameworks invoked to demand vaccine equity during the COVID-19 pandemic and at the same time used to resist public health restrictions. We've seen human rights language shape access to HIV treatment and appear in many global health declarations over the past half a century. But we've also seen persistent critiques. The rights frameworks can be too Western, too legalistic, or too disconnected from the realities on the ground. There is also a deeper tension here. Law operates both as a tool to advancing justice and as a reflection of power, revealing who holds influence, who gets heard, and whose health gets prioritized. My guest today has spent decades thinking about these questions. Professor Benjamin Mason Meier is a leading scholar of global health law, human rights, and governance structures. He's a professor at the University of North Carolina at Chapel Hill, UNC, with appointments both at the Chillings School of Global Public Health and the School of Law. He's also the co-author of 3 foundational textbooks on global health governance, law, and human rights. Ben has worked with the World Health Organization and other global entities and has grappled directly with the challenges of making the case for a rights-based approach that is meaningful across diverse political, legal, and cultural contexts. So today, we will explore what it means to frame health as a right and what the future of rights-based approach might look like in a world marked by fragmentation and rapid technological changes. Ben, welcome to the podcast.
Thank you so much. It's wonderful to join you during these challenging times for human rights in global health.
First, I really wanted to start just painting a picture for people who might not necessarily know what is global health law and why would we think about law when it comes to health and health outcomes. And I know you're a lawyer by training, so maybe you would want to explain to our listeners what made you think that law could be a determinant of health? What you were studying law, and then what was the moment that you thought, oh, this makes sense for me to think of law as something that could shape the health outcomes of people?
I think your introduction really helped to frame why law is necessary. How do we shift from saying health is a human right to making health a human right through our policies and making it real in people's lives? I began my career not as a lawyer, but as a scientist, thinking that we could bring about access to essential scientific tools to advance health throughout the world. But it became clear that we had many of these scientific tools, but we just didn't have the policies in place in order to bring about access throughout the world to the people who needed them most, to the scientific technologies that could improve health. And so I went to study law, and through that became convinced that international law across nations, could help us to advance human rights. And so I started to study human rights under international law as a basis for public health, trying to understand the ways in which we've sought to take these ideas of justice through human rights, to codify them under international law, and through that to shift policies throughout the world that can make the right to health real in people's lives.
Oh, that's interesting. I didn't know that you were first trained as a scientist. What type of scientist were you?
I was studying biochemistry. These
Oh,
were
wow.
exciting times. We had just cloned a sheep, and I had this vision that we would grow rice in the desert, we would be able to feed the world, and we would all hold hands and sing hallelujah. But but we never really got that opportunity. And I became aware of science policy and the ways in which intellectual property, patents, were stopping us from realizing access to health technologies in the most low income countries in the world. And so I looked to human rights as a way of shifting that narrative, of thinking about health technologies not as intellectual property that could be monopolized and hoarded by the wealthy, but as human rights that could be shared broadly across the world. And that human rights understanding was what really brought me to thinking about the right to health and the ways in which the World Health Organization exists to ensure that health is a human right throughout the world.
So, for those who are not familiar, what does it actually mean to think of health as a human right? And I think, as you mentioned, WHO, in its general framing, it is based on the idea that health is a human right. So, maybe walk us through the history of how that understanding was codified in global agreements.
It's really not possible to talk about health as a human right without beginning in the post war experience. That the Second World War, in some ways, and the atrocities aligned with it, highlighted challenges to human rights and helped to establish a post World War world order that would be shaped by human rights. And that's not to say that human rights hadn't been invoked throughout history in fights against slavery, in fights for universal suffrage, in fights against colonization. But the atrocities of the Second World War and the widespread immiseration and suffering of the Great Depression that preceded it really clarified the need for a new world order that would be grounded in human rights. And as the United Nations was established at the end of the Second World War, human rights would be one of the three pillars of that new international organization. With the Charter of the United Nations in 1945 making clear not only that human rights would be a central pillar, but that there would need to be the establishment of a new international health organization to replace the League of Nations Health Office and to create an opportunity to bring the world together, to draw from the ashes of World War II, to create a healthier world to come. And the Constitution of the World Health Organization, developed in 1946, really becomes the first international agreement to lay out the idea that health is a fundamental human right, with the World Health Organization laying this out in its preamble and laying out a system of global governance that would work to really rebuild the world in a way that would realize health as a human right. And we've seen over the course of the last 80 years now the evolution of that human right, not just as an idea, but as a concept of international law. That through the Cold War, nations would come together to develop treaties to uphold the right to health under the 1966 International Covenant on Economic, Social, and Cultural Rights, that we would expand it to cover a woman's right to health and the Convention on the Elimination of Discrimination Against Women. We would look to a child's right to health and the Convention on the Rights of the Child. And at the end of the Cold War, we would have a new opportunity to really shape what a right to health means under international law and how it can reflect understanding of public health, understanding of public health that had arisen throughout the years with epidemiology, with understandings of social determinants of health. And we would be able to shape the ways in which we think about health as a legal obligation. And the contemporary understanding of a right to health really seeks not to just talk about health as a human right, but to lay out the conditions through which governments bear an obligation to ensure that that right is respected, that it is not violated by the government, that governments protect the right to health to ensure that third parties, private actors don't harm people's health, and that we fulfill the right to health, that we lay out the underlying conditions in which health can be realized in our societies and through our policies.
Hmm.
And as we look to health, we think about the ways in which we assess and monitor health over time so that we can assess whether health is available in sufficient quantities, it's accessible to all people, it's acceptable on the basis of race, religion, culture, gender, and that it's of sufficient quality. And so we have both government obligations and attributes of a right to health that can be assessed at a government level to ensure that governments are making this promise of health real.
I think so. This actually touches on, maybe because I am an epidemiologist and a data nerd, but I do have questions later of then how do we measure all of those items that you suggested? Because I can argue with another epidemiologist about whether something is accessible or not based on the data we have. But I would love to talk about that later. But before that, I wanted to, maybe for people who are not necessarily familiar with all of the history that you talked about, to ground everything that we're saying right now in real world examples. So thinking about one or two examples that you can give us that taking the rights-based framing over the past half of a century actually led to better health outcomes. What was it that you think made the difference there? Was it the moral force behind shaping health as a human right? Was it the legal obligations? Was it that it was used as a tool to advocate or empower advocacy, or is it all the above?
Um, so, as the right to health has developed, we've developed a series of different obligations that have been applied across a wide range of health issues. And so it's one thing to say that human rights are developed under international law, but the question that you're speaking to is how are human rights then implemented at the national level through policies, through programs, through practices? And there are a number of different issues that we can think about that highlight the application or the implementation of human rights and the ways in which we've sought to ensure accountability for the realization of rights throughout the world. The most obvious one is possibly maternal mortality, that we begin to think about disrespect leading up to childbirth, that women's rights, fundamental equality begins to shape the motherhood experience. We think about medical care at the time of delivery, and we think about the postpartum experience, all of which implicate a series of policies. And once we begin to assess, are they available? Are they accessible to all? Are they acceptable? And are they of sufficient quality? We can begin to develop policies that have dramatically lowered the maternal mortality rate, as WHO has found in a 2011 study. Beyond the right to health, though, I want to raise the idea that there are a number of interconnected rights that help to support health. And one of the principal ones that I've worked on is around the right to water and sanitation. The right to water and sanitation was never mentioned. It wasn't mentioned in the Universal Declaration of Human Rights in 1948. When the time came to codify economic and social rights in the International Covenant on Economic, Social, and Cultural Rights, no one discusses water, sanitation, hygiene. It's only in the 1970s that we begin to see challenges to the quantity of water that's available during drought, challenges to the quality of water amid rising concerns around pollution. And so over the last 40 years, we've seen a dramatic development of a human right to water and sanitation, leading the Committee on Economic, Social, and Cultural Rights in 2002 to shaping what it would mean to talk about water as a separate human right. And in 2010, we would see the UN General Assembly declare water and sanitation as a fundamental human right to be realized by all countries. This has dramatically shifted the conversation around water and sanitation throughout the world. And over the past now 15 years, we've seen governments take steps to ensure that water is available, accessible, acceptable, also affordable, and of sufficient quality. But beyond that, we've seen the dramatic scaling up of rights based water and sanitation systems throughout the world and global funding agencies that have helped to dramatically shift the conversation around funding for water, sanitation, and hygiene. And none of this would have been possible without thinking about water and sanitation as a human right. And for that matter, no one discussing water and sanitation today would think of it as a voluntaristic action, as a charitable action. They would begin by recognizing that access to water and sanitation is a fundamental human right. And the last thing I want to raise is around my work in tobacco control. I think there's a concern right now that corporations have co opted the language of human rights, that they talk about a right to smoke, a right to drink, a right to put whatever you want into your body. And in some ways, this has shifted the conversation. And I worry that this co optation of rights around a negative vision of rights, a freedom from government intrusion, takes us away from government responsibility to ensure the highest attainable standard of health. And so I've sought to shift the conversation, not as a freedom to smoke, but as a right to health that entails a freedom from addiction. So, how do we support people who use tobacco in order to free themselves from addiction? How do we ensure the underlying environments in which children aren't exposed to tobacco advertising? How do we make sure that the conditions that shape non communicable disease are most conducive to health? And I think this is where we can think about examples of applications of human rights through national policy that can make a real difference in people's lives.
I think this made me wonder also, just maybe this is an educational session for me. Thinking about something as a human right does not necessarily, at least from what you're saying, and correct me if I'm wrong, does not necessarily automatically mean we're thinking about it as a law. Because I was thinking from what you were describing, the framing of a human right, freedom to or freedom from, that is really helpful in thinking about policies. And then once you start thinking about it from a legal point of view or what type of law you write, I don't know where then we have a conversation about values more. A value of, yes, it might be helpful to think about freedom from having exposure to tobacco or alcohol, but at the same time, you might be living in a context or a culture that says, no, 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 I actually prefer having the freedom to do something. So I was just thinking about, like, is there a difference between creating a framing of something as like, this is a framing of health as a human right, versus thinking about what a specific law would look like in a specific context. Like I'm thinking about the US here. I wonder if someone might argue a law that tells me I am prohibited from seeing those type of, or corporations are prohibited from showing those type of advertisements to children actually infringes on my other rights.
This is why it's so important to talk about human rights under international law as a basis for public health, and the ways in which we need to create a generation of public health scholars who look at the right to health as more than just a slogan, but as a legal construct. Because
Mm.
it's that legal construct that shifts us from advocacy to accountability, that we can begin to think about accountability under law. And there are lots of things that people can say are human rights. I have a right to respect. I have a right to love. I have a right to donuts.
Right.
But saying that doesn't make it a right as a legal construct. And so we look to international law as a way of understanding what governments themselves have agreed to as human rights. And then from that legal obligation, we can seek to hold governments accountable for meeting the obligations that they have set for themselves, whether those obligations are to end gender discrimination, whether those obligations are to end tobacco use, whether those obligations are to end cultural practices that may be harmful to health. And it's been inspiring to see the ways in which human rights shifted the World Health Organization's policies around female genital cutting or female genital mutilation, where what was once seen as a cultural practice through a series of in depth cultural understandings alongside a series of international legal prohibitions shifted WHO's own policies from accepting cultural practices to now arguing, I think rightly, based upon human rights, that this is a violation of the rights of women and girls and thus should be banned as a harmful practice for health.
This is interesting because I think it's also highlighting the tension in my own head, and it's great that you use FGM or female genital mutilation or cutting because I worked on female genital mutilation and cutting in Sudan, and it was always interesting. Like we for a long time we worked on going to cities, going to villages and talking to people about changing the practice. But then ultimately, a few years ago, we actually criminalized FGM in Sudan. And I think for a long time, we didn't think about it in a way that says, well, maybe we should ask the government to criminalize something versus just saying we should just always just go try and advocate or educate people about changing their practices. I do think there's space for both, but it was really helpful after it was criminalized in Sudan. It created more friction, even when those practices continue to happen. It just created more frictions in the system for whether someone can do this or not.
I think this challenge of cultural
Yeah.
relativism has been with human rights from the very beginning.
Yeah.
That as nations were declaring a universal declaration of human rights in 1948, there were those who argued that there can be no universal rights, that all
Yeah.
rights are relative to space, to time. But as the past 80 years have advanced, we've come to see that there are rights that can be universal, that there are rights that can be adjusted for different national contexts, but that they can still be respected throughout the world. And that
Yeah.
is, in some ways, the fundamental notion of human rights, that there are rights that no matter where you live, no matter what your government holds to, that wherever rights violations take place throughout the world, they are a matter of consequence for everyone in the world.
I'm glad you mentioned cultural relativism. It was struck me as for a while, and maybe this is too strong of a feeling when people say, oh, but culturally this would not happen. Like we shouldn't really infringe on the collective rights of maybe a culture to set guidelines to what they want to do versus like the individual rights of someone. And honestly, for a long time, especially when I started my studies in the US and I would bring up FGM, it always felt weird and sometimes offensive for people to say, but we need to respect cultures. As someone who came from a country that had FGM, and I was the first person in my family not to undergo FGM, to be told, but you need to respect the culture in the country. Sometimes, honestly, it's like the bigotry of lower expectations. It's like, oh, it's for that place, it's that culture. That's okay. We can live with it. And I felt like, but that does not respect the rights of the young girls usually who are undergoing those practices. But yeah.
And that's what we've seen more often than not, is that governments that purport to fight for the importance of culture are more often using culture as a guise for power, that
Yeah.
they're using it as a way to oppress and using cultural relativism as a rationalization for
Yeah.
systems of oppression at the national level. But
Yeah.
as an outsider, human rights can provide the ability to criticize a government's practices, even if they say that those practices are correct by their own cultural standards. And
Mm.
not just me, the entire United Nations system. Why should global governance have the ability to tell a government that what is happening within its own country is wrong?
Mm.
And that is what human rights provides, a set of universal norms that apply throughout the world, that no matter what the government says, can be recognized by international governance and protected by the United Nations system.
Yeah, I'm pretty sure someone is listening out there to the two of us and fully disagreeing and thinking that their culture should reign it. And if that's the case, email us and maybe we'll have a different conversation. But I fully agree with you on this. And it's also interesting to me when we choose to say, oh, governance is important or sovereignty is important. And when we choose to say, no, you need to actually implement international law, that also shows like who's in power and which one of those frameworks we decide to implement versus not. That's actually also very interesting to me. But
And
yeah, go
and
ahead.
so human rights has two different doctrines that apply in this context. The
Yeah,
first is called a margin of appreciation, that we
yeah,
recognize that not all countries will realize rights in exactly the same ways. And so there is a margin of appreciation for culture. That doesn't mean that fundamental rights can be violated, but that there is flexibility there. And that's really where governments say that they won't do something. The second example is where governments can't do something, where they say we lack the resources in order to make this right real. And in this context, we think not about a margin of appreciation, but a principle of progressive realization, where not all rights, particularly economic and social rights, can be instantly realized. We can't
yeah,
realize the highest attainable standard of health for all people throughout the world instantly. And
yeah.
so we begin thinking about a principle of progressive realization to ask the question over time, how are governments taking steps to progressively realize that right with the view to achieving the full realization of that right over time?
I think my question there for you is, are we thinking of a rights-based approach as something that is aspirational or something that could be used for litigation or both based on the two principles I just laid out? And I'm thinking the case I know that is usually used, I think, is a good example of how health as a human right was used in South Africa, if I'm not mistaken, but you would know the history more to during really the peak years of HIV/AIDS in South Africa to provide treatment. So, do you think usually of principles as a way to encourage countries to move forward on some rights? I'm not saying when they're clearly violating a right, but when they're saying we can't really do anything about this because of X, Y, Z in our country. So we're thinking about a progressive realization versus no, can be also a tool for someone in a country or a group, as it happens in South Africa. And maybe you can talk more about that example that pushes the government then to achieve. All right.
So let me take a step back and talk
Yeah.
about the HIV/AIDS
Yeah.
pandemic in its historical context and how it really is seen to have led to a health and human rights movement throughout the
Yeah.
world.
Yeah.
That leading into the HIV/AIDS pandemic, we saw that human rights could be limited in order to protect public health. But what HIV/AIDS made clear within WHO and through advocates and across countries was that we need to see health and human rights as what WHO called inextricably linked, that we need to see human rights protections as essential to health promotion. And this became clear during the early years of the AIDS response, where there was discrimination against affected populations. And that discrimination undermined public health efforts. Advocates made the case that they were human beings entitled to equal dignity and rights. And WHO accepted this. And through Jonathan Mann's work in the Global Program on AIDS, began to look to a human rights based approach to health, to thinking about the ways in which human rights could lay a foundation to prevent disease and to promote health. And as we developed therapies, antiretroviral therapies, medicines that could both prevent and treat HIV, advocates looked to these human rights, and specifically the right to health, in order to bring about access to essential medicines. The South Africa case that you refer to is based upon the work of the Treatment Action Campaign, which brought a case against the South African government to argue that there was a right of access to maternal to child, to prevention of maternal to child transmission of HIV, and fought in the Supreme Court of South Africa in order to have the court guarantee them under the post-apartheid constitution and its embodiment of a right to health, a right of access to this essential medicine. And we've seen this Treatment Action Campaign case serving as a model for cases throughout the world where courts are able to find that there is a government obligation to ensure access to an essential medicine as a matter of human rights. Now, that's a perfect example of what I said earlier about a principle of progressive realization. Not all governments have the ability to provide all medicines to all people at all times, but governments need to take steps expeditiously in order to promote the progressive realization of a right to essential medicines. And it's that right that has become a foundation for litigation throughout the world. But having said that, I don't want to say that litigation is the only path to accountability for human rights. One of the things the Treatment Action Campaign case showed us was the ways in which advocacy in the streets was complemented by advocacy in the courtroom. And we can look to the ways in which advocacy can complement litigation as a basis for accountability for global health. And knowing that you're an epidemiologist, data is a perfect source of accountability. That if we say that rights need to be progressively realized, we can look to epidemiologic data in order to assess whether things are moving in the right direction over time. So we can compare. We can compare across countries and we can compare over time to begin to assess whether governments are meeting their obligations to progressively realize the highest attainable standard of health.
Yeah. So then shifting gears, thinking more about global governance, which you've written a lot about, especially when it comes to global governance and WHO. And my first question is, do we think global government is too fragmented right now, or is it just stretched too thin? Or do you think, no, the structure itself, the foundation is strong enough, but we have some hiccups throughout the way that we just need to address?
So my early work studied the World Health Organization and the ways in which the World Health Organization's historical work helped to shape a human right to health under international law.
Yeah.
But one of the things that became clear through that was that WHO was not acting to implement the right to health the way that other UN specialized agencies were working to make human rights real through global governance. And that led to our 2018 book on human rights and global health, rights-based governance for a globalizing world, which looked across 20 different parts of the United Nations in order to assess how they are advancing human rights through their work to address a wide range of underlying determinants of health. So WHO obviously has the right to health as part of its core mission. But UNAIDS is working to advance human rights in the HIV/AIDS response. UNICEF is working to advance children's rights in its own work on health. UNESCO is working to advance health education as a human right. The International Labor Organization is working to advance a human right to occupational safety and health. And so that comparative study helped us to recognize fragmentations across the United Nations. And this raises an imperative to do what the UN calls mainstreaming human rights through global governance. One of Kofi Annan's initiatives as Secretary General of the United Nations in the 1990s was to help UN agencies understand that they too are responsible for realizing human rights. It's not just national governments that bear these obligations. And in order to do this, he put forward an agenda for mainstreaming human rights across global governance, making it clear that, as he said, the era of declaration of human rights, while not complete, must yield now to an era of implementation through global governance. And we've looked over the past 20 years now to try to understand the ways in which, as you say, there is a fragmented implementation of human rights across the United Nations system, and that we need to move toward more coordinated practices across the UN for mainstreaming human rights to advance global health. Whether it's in WHO's work, UNICEF's work, UNAIDS work, there are common practices that can be used in order to make human rights a central part of global governance and advancing public health.
I've been reading some of the work that you've done on this, and I think, if I remember correctly, there was a 2024 paper, so last year, that looked to, I think, as was countries were discussing IHR, and I think we must mention IHR because someone like me who's reading work on human rights or global governance and law, we're always just going to find that term. So I would love for you to explain more what is IHR that makes the argument that WHO has trended, I think that if I remember correctly, throughout the years to focus more on the technical aspect of its work, just providing guidance, and not necessarily towards thinking more about the rights-based approach. And that might be a more helpful way of thinking about global governance. But I just, what you were saying, Raun, and thinking about the fragmentation, thinking about different entities working together or working in different areas that should be really leaning towards the same direction of realizing health as a human right. The question then is, can we actually create accountability in a system like this? I know that article that you wrote was part of thinking more about like how do we create a better IHR or thinking about, I think, about the pandemic treaty, but just the system you described right now, that there are different entities in the global system working in different directions. Can we create accountability in a system like that?
I think WHO has long said wrongly that they are not a political organization and that they don't engage with human rights because they are trying to remain apolitical. And this has been a failure every time it's been said. That every time WHO says that it's not a political agency, it loses the political debate immediately because it's not even participating in it. Human rights have provided a way for WHO to advance health under international law. And law is a foundational um, aspect of WHO's governance. The IHR, the International Health Regulations, have been crucial to WHO governance over the years. The Framework Convention on Tobacco Control, one of my first opportunities to work with the World Health Organization, has been foundational to tobacco control. And now we have a pandemic agreement, a third treaty that's been developed under the World Health Organization in order to advance health throughout the world, not just as an aspiration, but as a legal obligation. And the IHR is crucial in dictating how governments will respond to public health emergencies of international concern. And when the World Health Organization's member states were revising the international health regulations in 2005, now 20 years ago, they made it clear that implementation of the IHR should respect human rights. And one of the challenges that we've seen through the years is what that means in practice. And WHO can play a crucial role in ensuring that governments implement what we call global health law, international legal obligations under WHO, in order to make human rights real in public health. But we saw this need for human rights in the IHR in 2005 based upon the experiences in the SARS epidemic, where the response to SARS, where it was not rights based, undermined both national responses, but also global solidarity. And so the 2005 revision of the IHR made clear that human rights is essential to implementing the IHR. And one of the fundamental challenges of the COVID-19 response is that governments once again turned to human rights violations. That when faced with a novel threat, much as they did with HIV, they resorted to fear, to discrimination on the basis of national origin, discrimination against marginalized groups, divisions and travel bans that were unhelpful to the public health response. Governments also violated the right to health, both in health system preparedness, but also during extended lockdowns and making sure that people would have access to underlying determinants of health. And then finally, we saw violations of government responsibilities under human rights in the IHR to ensure global solidarity, to ensure that governments are cooperating internationally and providing assistance to ensure that the right to health is real throughout the world. These experiences undermined the early pandemic response. And when it came time to ensure access to vaccines for COVID-19, they made clear that there wouldn't be the solidarity, the global solidarity that was necessary in facing a truly global threat. And so human rights needed to play a greater role in amendments to the IHR in 2024. And we developed a series of articles to make clear the human rights violations in the pandemic, and to also make clear why human rights based reforms were necessary in amendments of the IHR. And I worry that amid rising international divisions, amid rising illiberal governments throughout the world, we saw a pushback against human rights, both in the 2024 amendments of the IHR and in the pandemic agreement. And those human rights limitations will undermine our public health response to future public health emergencies of international concern.
Two questions here, maybe two big questions that might take us into two different directions. But this is helpful for me to think about, like, how can we think of human rights as we're drafting pandemic treaties? You had people from the WHO who say, well, when people like Ben, they have not used the name Ben, I'm just using you as an example. Uh, they're forgetting when they say WHO, when it says it's apolitical, it loses its ability to have a conversation in the political world, and it needs to take a stance from a rights-based framework, that they forget the real politic of the world, that we need to work with different countries that are very strong, and we don't necessarily have any way of pushing them to enact anything that we implement. And we're going to talk later about the US just maybe pulling out of some of the global agreements that we have. So one objection to what you're saying could be that, well, we just don't necessarily understand how the world actually works. We can push for your framing, but that doesn't necessarily get us anywhere that is useful. Maybe it's also linked to this, because I was thinking it is great to think about the law, and it's great to think about a rights-based approach to health. But I think you use like some of the things countries did during COVID, the early days of COVID, as a way of thinking about how countries violated human rights. But if I remember correctly, you and Jude, we were working on a project, and we had a conversation about, like, could countries close their border or not during a disease outbreak? And the two of you came at it from different point of views, and one of you had one view about could countries do this versus not. I think that conversation for me, it was a few years ago, but still stuck in my head. It's similar to epidemiology, where we can have a governing principle, but even people who are experts in the topic can come at it from different views and might not necessarily fully agree on what is possible under that specific law or a specific framing.
And I think in this way, human rights provides a common language so that we can have that conversation.
Okay.
And one of the things coming out of our initial study of the UN that was clear to us was that many people studying public health lack the ability to talk about human rights beyond the slogan. And so in 2020, we developed our first textbook on foundations of global health and human rights. And in 2023, coming after the COVID experience, we developed a second textbook on global health law and policy to help to understand the foundations of global health law. WHO, in many ways, shies away from human rights because it thinks that it's political. But more importantly, it lacks the ability to engage with human rights as a legal construct because many WHO staff members went to school and studied public health at a time before understanding of human rights was prevalent, at a time before understanding the importance of public health law became so crucial to understanding public health advancement. And so part of it is WHO's inability to have that conversation around human rights. And you and I had the opportunity to work together as the IPPPR, the independent panel on pandemic preparedness and response, was considering some of the limitations of human rights in the COVID-19 uh, pandemic. And Judith Bueno de Mesquita and I were part of a team that was considering the human rights challenges that were faced. And even when we're talking about human rights, as you point out, there can be disagreements about what exactly it means to talk about proportional responses. So if we think that human rights can be limited in order to prevent the spread of disease, to what extent do we assess whether those public health limitations of human rights are necessary, whether they're proportionate, whether they're time limited, and whether they're challengeable? And so, out of these experiences and our conversations in developing our report for the IPPPR, we worked with advocates across countries through the Global Health Law Consortium that brings together legal academics in global health throughout the world. We met over 3 years with over 150 different public health actors throughout the world. And we developed what we call the principles and guidelines on human rights in public health emergencies, which seeks to clarify what human rights mean in the context of public health emergencies that had never been done before, but also to try to elaborate the different fundamental principles and norms that should be considered in deciding, for example, whether travel restrictions are appropriate, in deciding how much vaccine inequity is too much vaccine inequity, how to decide what role WHO should play in dictating, in setting guidelines for health standards throughout the world. And so these principles and guidelines for human rights in public health emergencies, which we finalized in 2023, really help to clarify what it means to talk about human rights in the context of pandemics, and really sought to shape the development of the amendments of the international health regulations and the development of a pandemic agreement.
Mentioning the pandemic agreement reminds me of the elephant in the room, which is something you've written about a lot recently, is that the US has decided to step back from being part of a global conversation about dealing with pandemics. I know people have different feelings about the pandemic treaty, so I don't know where you stand on the final wording of the treaty. But I think you've written with Professor Lawrence Gostin about the importance of the USA being part of the conversation. So I'm thinking a bit about what does it mean, you're from the US, for a country that has a lot of influence like the US to step back a bit from being part of that conversation?
For the last 80 years, the United States has been central to global governance in the context of public health. The United States was instrumental in the founding of WHO and the development of the WHO Constitution, has been a leading member in guiding public health, but also human rights in global governance. And some of the challenges that we're seeing right now are part of a larger um, limitation on human rights, on public health, and on global governance that have culminated in the withdrawal from WHO. And so we've seen the current administration really challenging this fundamental notion that all persons are equal in dignity and rights, challenging the rights of migrant populations, challenging the rights of minority populations, challenging the rights of women and trans populations. Beyond that, we've seen real attacks on public health science, attacks on data, attacks on public health officials, attacks on the idea that policy should be evidence based in its foundational development. And then finally, we've really withdrawn from the idea that human rights in public health bear a collective responsibility for the entire world. We've stepped back from global governance. We've done this before with the United States seeking to withdraw from the World Health Organization in the early days of the pandemic in ways that would prove catastrophic, both in the United States and throughout the world. And we are seeking to withdraw from global governance again in ways that will undermine both bilateral assistance to support the most vulnerable populations throughout the world and the ways in which we come together to address common public health challenges in a globalizing world through international cooperation. It's these compounding violations of global health and human rights that leave the United States vulnerable to health threats, that leave the world increasingly divided in facing our common challenges, and which really threatens, in an existential way, the global governance system established at the end of the Second World War that has carried us through a series of public health challenges over the last 80 years and now is under threat.
So, Ben, I know this is outside of my area of expertise, and I know this is beyond what you work and think about. But a question that I'm increasingly thinking about these days is where have we missed the opportunity to make it clear the importance of the work that is being done globally, global governance? Have we just not communicated it well enough? You have a populist movement here in the US, but you have it in other countries, right? Like there seems to be a global retreat, or as you said, also some illiberal governance across the globe of people just saying, we need to just be thinking about our own country. We need to be thinking about our own sovereignty, and we're not engaging the global conversation. Is there something that we should do or could be doing that we just have not been doing as a global public health community? I would be interested to hear what you think about this.
So I think part of it is making sure that public health puts away this lie that public health is apolitical. That in some ways we are doing a disservice to public health when we don't prepare public health actors for the political challenges that they will face. So we're working with the Consortium of Universities for Global Health, CUGH, to help to develop advocacy tools. We developed a series of articles making clear the implications of the 2024 US elections on global health. And following that election, we've developed a series of advocacy resources so that public health actors know how to engage in these political debates that will prove crucial to the future of public health. And secondly, we need to make sure that an understanding of political action, an understanding of human rights, and understanding of law is really foundational to public health education. And that's why, even as we face many of the human rights challenges that we're facing today, we've continued to work to develop textbooks and to develop teaching resources so that students who are studying public health in the United States and throughout the world have the ability to learn about the foundational importance of human rights so that that isn't questioned in future legal negotiations. That future health policymakers not only understand public health, but they understand global health law so that they have the ability to shape agreements that can best prevent disease and promote health. I think in some ways, the present challenges make clear that this is really a generational project, that we are not just responding to the exigencies of the moment, but we're beginning to think about building a new generation of public health scholars, practitioners, and advocates who, at their foundation, understand what it means to say that health is a human right, not just as a slogan, but as a framework for public policy, and that they have the law and policy skills to develop those policies that can make the right to health real in people's lives in the world to come.
So then ending on the rapidly changing world we're living in, not just from governments across the globe, but just technological changes. We have climate change. We have conversations about what does artificial intelligence, AI, or digital health data mean for thinking about law and health. And I was wondering, in this new era that we're entering now, what does it mean to think about a right to health? And does the law or this framework of a rights-based approach change or remain the same as we think about those really complex challenges?
So, when we talk historically about human rights, we're talking about a government obligation to provide for its people. But once we start thinking about some of these common challenges that we face today, climate change, for example, we're not talking about the obligations of one government, we're talking about the obligations of all governments. And we're not talking about just one person, but we're talking about all people. So, how do we shift human rights from the rights of individuals to the rights of collectives? And in some ways, we're very good at this in public health because public health is already thinking about population level health indicators, already thinking about public actions to protect the public. How do we shift human rights in order to address threats of climate change and threats to planetary health? And this is one of the projects that we're developing now is how to talk about not just the rights of individuals, but the rights of the entire world, the world itself, as a rights holder, so that we can best protect some of these new threats. And this is the challenge going forward. The human rights system was developed 80 years ago to really respond to a specific threat arising out of the Second World War. It's evolved over the last 80 years to address issues of decolonization and the rise of the global South, to address issues of inequitable economic development and neoliberal attacks on health systems. It's evolved to address threats to the entire world coming from climate change. We need to think about how human rights can evolve alongside global health going forward so that public health law, human rights law, and global health law can align as we move forward to address challenges that will require not just the global health system, but will require partners in the UN's human rights system and will require advocacy at the intersection of public health and human rights in ways that will be necessary to shape policies to address these real existential challenges.
Then the last question I usually ask people, and I stopped asking what keeps you up at night because I realized if you're asking someone who cares about public health, those maybe that's a kind of worm we don't want to open. Is really what is one narrative that you think people get wrong about, and maybe in particular people in public health get wrong about thinking about health and human rights, and that should be more complicated. Do we think we're oversimplifying using health as a human right? As a slogan, exactly what I just said, or is there more complex issues that we're missing in this conversation?
So I'll begin by saying that sleep is important and that people should get sleep at night.
Okay.
One of the fundamental things that came out of the pandemic response, and one of the things I try to instill in my students, is that the best way that they can take care of the world is to take care of themselves. That personal wellness can become a foundation for global governance. Now, shifting to global governance, we recognize that Dr. Tedros, as the Director General of the WHO, has been a crucial advocate for the right to health and will frequently proclaim that health is a human right as a political foundation for the statements that he's making. One of the things we need to do is we need to be able to translate that commitment to health as a human right into an understanding of how policy can shape human rights in public health practices throughout the world. And that is what I see as my mission going forward is to translate this commitment to health as a human right into policies that can make human rights real. It doesn't matter that we say that health is a human right. It's become a crucial rallying call for political advocacy. But if we want human rights to be real, we need to understand the policies that can make health available, accessible, acceptable, and of sufficient quality. Because without policies in place, we risk continuing backsliding through illiberal governments, through challenges from corporate actors and commercial determinants of health, through backsliding that comes about because we've missed out on some of the historical origins that led to the birth of human rights. If we want human rights to be sustainable, to help guide our health policies going forward, we need to recognize the importance of law in codifying, to establishing these rights in law in a way that will make them real, not just for today or tomorrow, but through the health crises to come.
Thank you, Ben.
Thank you so much.
This podcast was edited by Zach Leonaris and Catalina Melendez-Contreras. It is supported by the School of Public Health and Frick Initiative at Washington University in St. Louis. You can access this and other episodes wherever you get your podcast, or you can watch it on video on YouTube. Thank you for watching.